Hello and good afternoon to all of you. I am Dr. Anand Kumar from the Orthopedic Department of Al-Sharq Hospital, and I am going to give a brief introduction and a small update on two of the very common and very chronic conditions, arthritis and osteopenia. As you all know, arthritis and osteopenia are two distinctively different conditions, but they are also similar because both are chronic and mostly affect older people, and predominantly this can be controlled to an extent by activities, regular diet. So I will talk of both of these things. The first one is arthritis. So arthritis is derived, the word arthritis, the term is derived from the Greek literature. Arthritis, arthro means joint and itis means inflammation. As you all know, everybody uses gastritis, sinusitis. Itis basically is attached to the element where it is inflamed. For example, if it is the stomach, it is called gastritis. If it is in the sinus, it is called sinusitis. So same way, arthro is joint. So you are calling this as joint inflammation. So now let us come to joint inflammation. There are hundreds of different types of joint arthritis or different classifications. We will not indulge in all those. We will stick to the most commonly encountered arthritis. Now the most common arthritis which is encountered is the osteoarthritis. As we all know, osteoarthritis basically means a degenerative or a wear and tear arthritis, which is very common with people as we age, because normally all the joints there is wear and tear in the normal joints as we use. Like you use the word, the more you use, the faster you lose. This is exactly, it applies to all the joints, and the most common arthritis or the osteoarthritis is seen in the weight bearing joints, especially the knee, ankle or the hip. Relatively uncommon is degenerative osteoarthritis of the knee, of the elbow and shoulder, because it is not a weight bearing joint. Okay. Now coming to another common arthritis is the rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disorder. This disorder is usually genetic, or it is basically the autoimmune, the immune body immune system attacks the joints. So this is mostly genetic, and this is something which can be detected and treated, which cannot be cured. Now coming to another common arthritis is the metabolic arthritis, which can be caused due to excess of uric acid, which is known as gout. We all know that increased protein intake, increased meat intake causes arthritis. So this is a metabolic arthritis. Then we come to the septic arthritis. Any infection in the joint can cause what is known as a pyogenic or a septic arthritis. Septic arthritis basically means there is active infection in the joint, and this is a reactive arthritis. Now you also have arthritis which can happen due to other conditions like psoriasis. Psoriasis, as we all know, is a chronic skin disorder, and this can cause polyarthralgia, arthritis. So this is one of the reasons. Then there is viral arthritis. Very commonly hepatitis or even regular simple viral infection can cause arthritis. Usually this settles down once the viral infection settles down. Now coming to the symptoms of arthritis. Symptoms of arthritis, it cannot be missed. It is very obvious. A person has swelling, a person has pain, he has stiffness, he has warmth of the joint, he has lots of function of the joint. So he will come to the hospital, he or she will come to the hospital to seek medical help because he is disabled and he is in pain. So that is that is one of the differences between arthritis and osteopenia or osteopenia. Yes. So osteopenia is a silent disease, whereas arthritis is a very obvious and very clear condition. Okay. Now coming to the risk factors, or rather coming to how do we diagnose an arthritis. An arthritis is diagnosed basically on a good physical examination. We also can find out if the joint is swollen, joint is tender, joint is warm, and the loss of movement. So very easily and very clearly it can be diagnosed clinically. Okay. So, this is number 1. Number 2, we do some laboratory blood tests like a complete blood count to find out the WBC count. We also do CRP. Raised CRP implies an acute infection. ESR, erythrocyte sedimentation rate, it also implies a chronic infection. Then in case of autoimmune disorders, we have special tests like rheumatoid factor, we have anti-nuclear antibodies, we have anti-CCP. These are specific tests done to find out autoimmune disorders. Also there are special tests like HLA-B27 tests, which we find out if there is ankylosing spondylitis. Of course, we also have other techniques like X-rays, CT scans, MRIs to diagnose damage to a joint or the arthritis, the element of arthritis. Now coming to the risk factors, now like I told you, there are certain things which like degenerative arthritis, most of them are related to age. Then obesity is one other factor. Then repeated injuries to a joint can cause degenerative or an osteoarthritis because of damage to the articular part of the joint. So then some of them are autoimmune, which are transmitted, it's genetic. So these are the risk factors. Now coming to the treatment of arthritis, the most important treatment is activity, increased activity. We want you to have a good lifestyle so that your joint is kept supple. So that is number 1. This is how you prevent it. Now once you have arthritis, how do we treat? We treat by non-steroidal anti-inflammatories, analgesics, treat by rest. We splint the affected part so that the inflammation comes down. We give NSAIDs for the inflammation to come down. We do physiotherapy. We do physiotherapy so that we can bring down the inflammation. We have braces. Then we also have injections. We can inject the joint with a steroid to bring down the inflammation. We have, for people who have no fluid or less fluid like a degenerative osteoarthritis, we have what is known as hyaluronic acid. This is a mimicking synovial fluid which is deficient in the body. We inject it. This is a very safe injection. We also have PRPs. We have, we take out the bloods and we inject that to heal the arthritis. Then of course we have other things like we have for rheumatoid arthritis, we have disease modifying drugs which bring down the inflammation and keeps the autoimmune disorder in control. Then we have immune modification drugs. These are all specialized and quite toxic drugs, but sometimes it has to be used. And then of course then we have the surgical treatment for arthritis. We have arthroscopy. Then we have in the final stage when the joint is fully spoilt or destroyed or there is no salvaging, we have replacement. We can probably replace most of the joints now. The technique is so good that we can give a person a painless, fully mobile joint. Now as we grow older, once the joint gets spoilt, there is no going back. You cannot change what has been spoilt. So in this case, the only option out is to change the joint. We can change the knee joint, where we can replace the parts which are worn out, and we replace it with high density polyethylene and titanium interface, and we have given everybody a good painless movements so that their quality of life is improved. So this is what it comes about arthritis. So like I told you, arthritis is a very obvious condition. People with arthritis, people with pain in the joint will seek medical advice. So that is one good thing about arthritis, that they can come in early and they can take treatment. Okay, this is number 1. We can keep the joint supple by good activities, by keeping our weight down and to mobilize and keep the muscles in good function. So this is arthritis. Now coming to osteoporosis, like I told you, osteoporosis and arthritis are two distinctively different conditions. If arthritis is a very obvious condition which is very obvious to the patient and to the doctor, osteoporosis is a silent illness or a condition which has no symptoms. So a person may have osteoporosis and may not know about it. So that is why it is known as a silent illness. The only way you can come to realize, or you realize that you have osteoporosis, is when you have a fracture. So most of these osteoporotic fractures happen with a very small or a minor trauma. For example, he may be bending over to lift something and he hears a crack and the bone is fractured, or he just leans over something and or a small fall can cause a fracture. Minor trauma, minimal trauma causing a bone to break is usually an osteoporotic fracture. Osteoporotic fractures are usually in older people. Very rarely is it in younger people. Maybe these younger people are on some medication or some drugs which are bringing down the density of the bone. So what does osteoporosis mean? Now osteoporosis, like arthritis, is derived from a Greek terminology. Osteo, as you all know, is bone. Porous, as you know, what is porous? Porous is basically bone which is weak. If you have a strong bone which does not allow anything to go through, then you have a porous bone. So porous bone means weak bone. So this is what we mean, osteoporosis, weak bone. So what does it signify? It signifies that there is reduced bone mass and reduced bone density. So the bone per se, thickness of the bone compared to a normal person is weak, and this is why it breaks with minor trauma. So what are the symptoms? The symptoms of osteoporosis is not as clear as arthritis. He may have intraceable pain all over the body which has no reasons, and this is when we have to investigate it. Suddenly an old man you can see him hunched back. So this is one of the symptoms. Suddenly a person can feel that over a period of time he has lost height. So this is another symptom of osteoporosis. But the most common reason why a person is diagnosed with osteoporosis in the clinic is fatigue, and with generalized body pain, multiple body pains, arthralgia. So this is why a person comes to the clinic and we investigate it. So diagnosis of osteoporosis can be done with a plain X-ray. We can do a plain X-ray and we are able to tell the quality of bone. If we can say that the bone is not as strong as it should be for that age, but this is not qualitative. You can't quantify this into osteoporosis. For this we have a special test called Dexa scan. Dexa scan is a dual X-ray. Basically it is a low dose X-ray, and this is a specialized X-ray, and what we do is it's a dual energy X-ray. It's a small procedure. It takes about 10 minutes, and the radiation involved in this is less than even a conventional X-ray, so it can be done multiple times. So when does a person need a Dexa? Any person who is above 50 years and who has a fracture from a minor trauma requires a Dexa scan to find out the quality of his bone, number one. Any woman above the age of 60 years or 65 years requires a Dexa scan. So initially it was 60 years, now they say up to 65 years. Any woman after 65 years needs a Dexa scan regularly, once in 2 years or once in 3 years. Any man above 70 years needs a Dexa scan to find out the quality of bone. Then number 3, any of the male and female below 60 years, below 50 years who smoke a lot or consume alcohol a lot require Dexa scan, because this is one of the most common reasons why you can develop osteoporosis. Now, risk factors. Age is a definite risk factor. As you know, as we grow older, this bone quality comes down. Why does bone quality come down? See, normally the calcium and the strength of the bone is dynamic, in the sense there is bone absorption and bone deposition, and this is equally maintained by our body by means of activity. So as we are active, the bone sends out a message saying that it requires calcium, requires bone, and it is deposited. Now as you become inactive, this stimulus is lost, so the bone is only taken away from the, the calcium and the elements are taken away from the bone, but it is not redeposited. That is what causes osteoporosis. So that is why the emphasis on osteoporosis prevention is activity and only activity. We need you to be active. We need you to have rigorous or at least moderately vigorous activity of 30 minutes 5 days a week. So this is something which is very, very essential, and as you grow older, maybe you can reduce the thing, but it is something which has to be done on a regular basis. Now, gender. Women are much more prone for osteoporosis, mainly because of hormonal issues. Now, until they are menstruating, you have estrogen which regulates their bone density, but when they reach menopause, that estrogen control is lost. So they are more prone to develop osteoporosis. A person's body size also affects. A smaller built person has more chances of developing osteoporosis than a well built person. So this is another third one. Then there are certain people who, like for example rheumatoid arthritis, some of the rheumatoid arthritis or even chronic bronchial asthma are treated with steroid. Steroids are a life-saving drug. Like you all must be knowing, the recent COVID, people who are really in ICU and who are fighting for life were given steroids. So these steroids cause osteoporosis. Okay. Now, this osteoporosis is caused by corticosteroids, which are essentially given to save lives. So this is one more risk factor. Then there are some people who take anti-epilepsy drugs. These also can cause osteoporosis. Then there are some people who are taking treatment for cancer. So this is another drug which can cause or which predominantly causes osteoporosis. Then there is also people who take thyroid medication. This can partly cause osteoporosis, or if not osteoporosis, osteopenia. Osteopenia is a milder form of osteoporosis. Osteoporosis is a full-blown, less density in the bone. Okay, so these are things. Smoking, excessive smoking, consume of alcohol on a regular basis can cause osteoporosis and osteopenia. And then lack of physical activity. This is one of the most easily preventable condition which we all should think. Lack of physical activity, like I told you, once you don't give stimulus to the bone sends out a message that it does not require calcium. So the calcium is taken away from the bone. There is only absorption, there is no deposition. So your bone goes weak. So this is why we need physical activity. Vitamin D deficiency is another very, very common condition which causes osteoporosis. This lack of exercise, vitamin D, calcium deficiency, these are correctable conditions where we can correct it and we can prevent osteoporosis. So that is why the emphasis is on this one. How do you diagnose? Like I told you, I already told you, we diagnose osteoporosis by a Dexa scan. A Dexa scan is an element which takes out your bone quality and compares it to a young person's quality. So this comes out as a T-score. A T-score is your measurements compared to a healthy, normal adult. Then there is what is known as a Z-score. This is compared to a person of your age. Now the most important thing is a T-score. T-score -1 and below is normal. -1 up to 2 is called osteopenia, or reduced calcium or reduced bone density in your body. Anything below -2.5 is taken as osteoporosis, and this has to be treated. So this is how we interpret the Dexa scan. Whereas the Z scores, the Z scores, is compared to a person of your own age. So this, if it is anything below -2 compared to a normal person, to your age group, then it is called osteoporosis. Now coming to the treatment of osteoporosis, the first and foremost is of course increasing your physical activity. Second, if there is a deficiency of vitamin D, calcium, to change that or to correct it. Number 3, if you are smoking, to reduce or stop smoking. Consumption of alcohol, to reduce or stop consumption of alcohol. So these are the first and foremost treatment of osteoporosis. Now coming to medications, we have what is known as anti-resorptive drugs. Anti-resorptive drugs is, like I told you, there is the calcium and the bone matrix is normally absorbed from the bone. So by giving these biphosphonates, these are drugs which are given so that the absorption of the bone is reduced or stopped, whereas only the deposition takes place. This drug does not control the deposition of bone, but it controls the resorption. That means the calcium and the bone matrix is not absorbed. So these are biphosphonates and these are anti-resorptives. Then you have what is known as anabolics. Anabolics are basically medicines which increase the bone strength by depositing more bone quality or bone matrix into you. So these are called anabolics. There are FDA approved medications which are called teriparatide, which are given on a regular basis, can increase your bone quality, can increase your bone strength. Okay. Now coming to how common is osteoporosis. Probably 50% of people above the age of 50 are either osteopenic or osteoporotic. Like I told you, osteopenia is a milder form of osteoporosis. Osteopenia is when the score is below or just around 2, and when that is minus 2.5. So up to 50% of the people above the age of 50 years are osteopenic or osteoporotic. Both of these are correctable or preventable. Now, for example, osteoporosis is definitely preventable. Osteoporosis, once it settles in, we can correct the osteoporosis, but the bone quality is always there. How do you treat? Now, if there is a fracture of osteoporosis, of course, a fracture of osteoporosis is treated according to it. If it is undisplaced, we immobilize it, we wait for the fracture to heal, we supplement with calcium and vitamin D. If it is displaced, we fix the fracture. Of course, fixing an osteoporotic fracture is a challenge because the bone quality is not very good. So we have special implants which hold the bone better. Even we have screws with hydroxyapatite coating so that it holds the bone much better than the regular screws. So this is how we treat osteoporosis. Both arthritis, like I told you, osteoarthritis is preventable because you can improve your activity, you can reduce your weight and prevent the development of osteoarthritis. Rheumatoid arthritis is something which is not preventable, but which can be controlled by disease modifying medications. I think this gives you a brief intake of arthritis and osteoporosis. I am sure if there is any query on this, we would love to answer it. We would love to address it in any medium, either in the same site, or you can always contact us for this. And thank you very much for your patience in listening to this.